The next patient I want to talk about is Jane, 44-year-old patient, chronic depression, insomnia, binge eating as well. Now, she worked in Somalia, so very stressed out, and she had a lot of stressful conflicts with her colleagues. Since childhood, she also had a lot of headaches, and we found out that it started when, during the time when her father was abusive to her mother. So there was a direct correlation between an emotional and environmental cause and the headaches, and that was also contributing to her state of depression, and that's why she needed antidepressants. She had been on Cymbalta for about 3 years, and what I want to point out is she has a fearful perception, right? And her vulnerability during childhood, her childhood stress, made her feel very vulnerable when she had conflicts with her colleagues. So these are all the signs you want to look at when you're assessing how safe it is also to take someone off medication, because we got to know these symptoms give an indication of, what are the causes of depression and what needs to be managed while you're coming off medication. Of course, the work stress and the conflict with her colleagues exhausted her adrenal glands. So here we have childhood trauma, right? So we need psychotherapy, we need counseling, we need homeopathy. And we also have the work stress and conflict, which is exhausting her adrenal glands. So we also need adrenal support, yeah, to stabilize her while we're reducing the medication. And of course, her binge eating caused sugar spikes and insulin spikes, and that destabilizes blood sugar levels, and that will also make the adrenal glands crash. So you can see here we have a range of approaches we need to manage while she's reducing Cymbalta. And what we did was basically use psychotherapy to resolve childhood trauma, and we use emotional freedom technique as well as homeopathy, um, to stabilize blood sugar levels and to stabilize basically the nutrients in the body. We got her to eat more protein than carbohydrates, so she didn't have these sugar spikes and insulin spikes, which were disrupting her adrenal function. And then, of course, because of the chronic stress she's been on, she has significant adrenal fatigue. I used rhodiola with her as well as ashwagandha later on. Beautiful combination that really helped her feel energized, more resilient, and also improved her ability to withstand stress. So even though she was in the environment still, she was less affected by it. And that's the beauty of adrenal herbs. They really support you emotionally, even though you're in a stressful environment. And of course, to also calm her nervous system down, I used acupuncture as well as Bowen therapy, because that all resets the adrenal system and takes her out of the fight or flight response. So you can see that as we're reducing medication, we made sure that the pillars of health, the fundamental pillars of health, right, the adrenal system, the diet, the blood sugar levels, all these have been taken care of, so that she goes through this transition much more smoothly.